and came across the Oppenheim hand or useless hand syndrome. So Hermann Oppenheim was a German neurologist, very prominent in his time, did a lot of work on polio and syphilis, published several textbooks. And he was the one who described the useless hand of Oppenheim as a manifestation of multiple sclerosis in 1911. And he was actually addressing the ABN at the time. So it's characterized as a functional disorder with loss of sensory modalities and preserved motor function. You recognize that this profound loss of proprioceptive function with relatively preserved strength was actually due to cervical cord lesion, predominantly affecting the posterior columns. So the patient might present having a bilateral syndrome. It's usually asymmetrical, in which both upper limbs would show loss of position and vibration sense. Usually one hand is affected. There's pseudoatetosis, so very slow, continuous writhing movements of the finger or hands, and it's much worse on eye closure. It looks like fingers searching in the dark for something in the darkness. And it's actually suggested that you examine the patient with them on eyes closed or distracted, looking away, as well as looking at the hand. There's reduced joint position and vibration, which in the context of wrist reflexes with preserved spinothalamic function would point to a posterior spinal cord lesion. Of course, asymmetry and the tempo involved may point to inflammatory demyelinating cause. And I just thought I'd put in a bit of a differential diagnosis for loss of function in the upper limb. And this was taken from one of the practical neurology papers. So for a cortical hand with a parietal lesion, there would be other clinical features such as neglect or cognitive issues. In a functional patient, the tempo is a bit different, and when you distract them, you see a clear improvement. Of course, other dorsal column pathologies, and of course, for your central neuropathy, neuropathic pain might be a very prominent presenting feature, or your peripheral neuropathy, such as CIDP, where the time course is a bit different, and you're looking for sort of maybe a large sensory fiber involvement, length-dependent peripheral neuropathy, and of course, if it's a chronic cause, it's quite different to the OPM hand. Yep, that's me there.